For me, the best thing about radiation and taking care of these particular patients are always feeling like you're helping the patient. You're allowing them to potentially have a very curable outcome for a disease process that can be overwhelming and intimidating. I always feel it's helping someone getting through a transition, whether it's getting toward curative intent or palliative intent. Radiation is energy. It's enough energy that it kills cancer cells. The way it works is you aim it at a particular area and it kills the cells in that area. So radiation oncology is a way for us to give radiation treatments for patients with cancer. It is integral in the overall treatment plan for a patient with cancer. Through the 16 years I've been here, there's been a lot of just growth of personnel, patients, equipment. We've been able to implement a lot of new programs in radiation. We have certainly grown as a practice within us and then within medical oncology itself. Our patients are coming from many different places, not just Moore County, but the adjacent counties as well. So our role as radiation oncologists is to meet with the patient, go over their pathology, and go over what entails to get radiation treatment, the side effects, how we set up patients every day for their treatments, some of the devices we use to immobilize people, and then going over what the course of radiation will entail. So whether it's a series of 2 to anywhere from 6 to 8 weeks of radiation. That's usually the next step after a surgical procedure or opinion. And then sometimes we correlate with chemotherapy, so they get both treatments together or one before the other. So we integrate with surgeons, medical oncologists, pathologists, radiologists, and then certainly ancillary services, dietary, phlebotomy, financial navigators, case management navigators. So we are always kind of in team mode, which is really a great thing for us to be collaborative always. But right now it's pretty piecemeal with people physically being in one place or another and not being able to come back over to see or meet a patient. It's a lot more difficult to kind of make that coordination happen. So we're certainly looking forward to the new cancer center for many reasons. The biggest one for me, I feel, is just the collaborative effort that we'd all be together in one place. It will be really nice to just run up and say, this is what's happening, what do you think? Or let's take a look at that together, or look at this image and tell me what you think. That's going to be the physical importance of that for not just us, but also with the patient. They only have one place to go. Oftentimes they're in our department for radiation and in the medical oncology office on Page Road for their chemotherapy at the infusion center. Sometimes they're doing that the same day. And we have patients who get lost because the campus is big and there's many different buildings to try to get from one place to another. So this will be really a lot better for them in terms of coordinating all of their care in one location. Then they can actually have all the ancillary services in one place too, like the navigators, like the financial navigators, all the dietitians. You know, everybody kind of being in one location will help just that patient feel as if they're cared for. The other, obviously, steps are just being able to expand our services for radiation. We have 2 linear accelerators now that will be replaced with new accelerators and then allow us to do some of the new edgier type of treatments. So that for us is very exciting because we can offer more services. So the new Comprehensive Cancer Center ideally will allow us to grow in multiple levels. I think from our perspective in radiation, to be able to offer additional services or even have a convenient option for a patient who's getting both treatments is going to be so helpful. Our outreach to other communities may be a little bit easier, again, coming to one location and one stop, and then having everybody in one place so that we can all take care of a patient as a whole is going to be so much better.